Now, doctor, shock. Hypovolemic shock. How much fluid loss? 20 to 45%. So you should know, doctor, this is one table. 100% you should be sure. इसके पहले भी हम इसके बारे में जनरल मेडिसिन में डिस्कस किया अध्यक्ष महोदय, इसलिए इसके ऊपर जरा ध्यान देना पड़ता सारे लोकसभा मेंबर्स. So doctor, blood loss less than 15% class 1, 15 to 30 is class 2, 30 to 40 is class 3, more than 40 is class 4. Don't forget these percentages. Doctor, definitely one question, which class of shock it is? Examiner आपके साथ खेलेगा. Shock होता है decreased volume of circulating blood. What is common to all kinds of shock? Any shock में होता है hypotension. All shocks. If you want to measure whether volume replacement is adequate or not, what is the simplest, best bedside clinical way? Vishayapan professor, ward rounds में, he used to look down the bed. The purpose is, he used to check the folic acid. अगर आपके follow-up notes में, case sheet में, not only nurse, as a resident, you also should write the fluid. अगर नहीं है तो, he used to make you run to the washroom. So while presenting case or case findings to him, in the beginning days, we used to turn back and look. He used to be invisible suddenly. Where is he? He used to be there below the bed, looking at the folic acid. Some professors are very obsessive, doctor, right? So tomorrow, February में आप MD residency में join होगा. आपको मिलेगा एक constipated faced professor. 3 साल उसको handle करना is as important as handling patients, doctor. Because MD is a degree that you don't earn. You are being thrown. It is like a begging bowl as a postgraduate. परमपिता परमात्मा प्रोफेसर साहब प्यार से अच्छा ठीक है पास कर दो, इस बंदे को बोलना पड़ता, right? So the challenges are different at different stages of life, doctor. You are thinking NEET PG is only challenging. No, doctor, NEET PG is the smallest challenge. It is enjoyable because you are preparing. Life is a big challenge, right? So tomorrow you are going to learn interventions, procedures, do 36-hour night duties with all your eyes swollen to go into that cohort. Now you are preparing. So be in the same dream. God-given opportunity to become really great. Accurate method to measure the fluid replacement होता है bedside urine output, other is central venous pressure.